Welcome to A Better Way, a sustainable approach to dentistry. I am Dr. Reid Winick, founder of Dentistry for Health New York.
Hi, I'm Tammy Kohlschmidt, dental hygienist, clinical thermographer, and body talk practitioner.
And tonight we're here with Alan Steinfeld, who is the founder of New Reality's TV and radio show, also has a very large web presence, and we're going to talk about what he considers to be the new paradigm in health.
Okay, anything you want to know? No, it's not just, I mean, my show is not just about a new paradigm in health, but a whole new paradigm in looking at who we are as human beings. So it includes health, of course.
Of course.
And so I think dentistry, and I've been working with Reid, Dr. Reid Winick, and Tammy on their show for a while, for about 2 years now. I really think dentistry is a key component in health, like you've been saying on all your shows. So what do you want to know about me?
Well, I want to talk about the new paradigm. And I think because of your health background as an acupuncturist.
That's right. People don't know I'm an acupuncturist.
That's right.
Right, trained for 4 years, right?
4 years, 3 with a license and another additional year in New York, yes.
Well, with this new paradigm, why do you feel it's mind, body, spirit, and not just body, which is how everyone approaches it?
It's just body, because it's obvious that what you think, how you feel, affects neurologically and physiologically certain enzymes in the body.
Right.
So what you think or your mind affects the body, but what makes you think a certain way is the predisposition of the spiritual energy. So I think it's, you know, we're here to learn certain lessons as evolving beings in consciousness. Those situations create emotional ideas and understandings that then affect the body.
Okay.
Does that make sense?
It does. But so my question is, what was your lesson through health? Because we've each had a lesson.
I know you have, and on my show we'll talk about your lessons. But you know, for years.
Well, when you were growing up, when did you make the shift to this?
Well, I'll tell you.
Yeah.
I had constant allergies when my nose was constantly running. I always had a tissue in my hand when I was growing up. And my mother took me for allergy shots, and I saw. I had asthma sort of as a child. Same with you. Yeah. And I noticed that sort of ran in my family. And then when I got to college, I stopped eating bread.
Wait, was that a choice, or you had no bread in your house?
You had no money for that.
No, I had bread, but I didn't live by bread alone. No, it's like someone said, you know, you might have a wheat allergy. That's why your nose is constantly running. And
how long ago was this? When you were in college?
This was like 20 years ago, something like that. So I stopped eating wheat, and you know what? I didn't have a running nose anymore.
No more tissues.
No more. No, it was miraculous. I simply changed what I was eating. I had, you know, bread is around everywhere. Wheat is everywhere, and all of a sudden I wasn't eating wheat, and I felt 100% better.
Right. Well, that was the same exact experience I had.
With what?
With all my illnesses, all my problems I was facing. It was the wheat was the first thing I did, and it cleared up the majority of my issues.
You had Crohn's, right?
Yeah.
But in 5 days, but I had night sweats, and I had drainage, and I had infections.
And operations.
And many operations, and I was about to have another. And just by getting rid of the wheat, I had a huge change.
Isn't that incredible? You're in the medical field, and you're studying, and you went through all this, and yet a simple thing like stopping eating wheat cleared up your whole. So what does that say about the medical field then? About what they're preaching?
Well, it says that they're stuck.
Yeah, they don't know.
Because what was interesting is when someone told me to give up wheat, I tried it.
Yes.
It worked. Then when I went back to my doctor and told him the great experience I had, he didn't say, wow, let me try that for my other 100 patients and see what happens. He said, Reid, you're in denial.
He actually said that to you.
Actually.
You see, this is why it's so important to change the paradigm of what we're thinking about reality. He was in denial about the possibilities that things...
That food can affect you this way.
I mean, he's a doctor. He was treating you for an intestine. This is your intestinal...
Right.
And he said...
Best in the world.
Well, he obviously wasn't.
Well, his world.
And what was your situation? Because I know you grew up with...
asthma, pneumonia, bronchitis, allergies, eczema, all of that in a big mess.
And then what changed for you?
Many things. My mental attitude, my spiritual attitude, my diet, which brings me back to the denial about food. And people just don't want to realize that what they eat affects their health.
Right, exactly.
Period.
You know, my father got very sick because he had an environment. He was working as an engineer, sort of a detailer above a steel mill, and he got this illness, this bone disease
From his inhaling
the iron and the welding fumes.
Yeah.
He went to a very good doctor. He gave him 2 years to live. I told him about macrobiotics. He went and told his doctor about macrobiotics. He said, and he had a book. The doctor threw the book across the room and goes, "Eat a pastrami sandwich." And this guy's only given him 2 years to live.
Yeah.
And so I said, well, why don't we try macrobiotics? So he went full on
He did it.
macrobiotics. He talked to Michio Kushi. We went on retreats. He lived for 10 years.
Oh.
Wow.
And probably would have lived longer, but he had to get the stuff out of his system that
Right.
was so deep. But no, I mean, it was way beyond what was predicted, and all because he gave up certain foods and was totally dedicated to the macrobiotic way.
Right, but he was able to get out of his own way and say, well, maybe there is a possibility that I don't know what I don't know. Let's try it.
But why don't doctors feel like, I don't know what I don't
Well,
know?
I'll tell you why.
Yeah, tell me.
Because
Is
you
it
know,
because they haven't learned it in school?
No, because of the
no.
way they condition doctors.
well,
I think.
but who gets conditioned to be? Who's a doctor? Who goes on to medical school when you were in high school? It's the brain, the kids who are really smart.
Yeah.
And how do they test in school? They test by memory.
Yeah.
The person who can recite the book the best and answer the questions that they're given. So they're becoming robots. And then they go on to college, and it's the same thing. They're just taught to spit back the same information, but that's what they're conditioned to do. That's how they get their benefit. So now when they go to medical school, it just continues. It's not the free spirit, it's not the free thinker who becomes a doctor.
Right.
But they're also taught to diagnose and prescribe, so that's part of their paradigm.
Well, that's also part of just being trained that way.
Yeah.
Right, but that's all they know.
Yeah.
So, how do they? You broke out of the box. You were trained the same way as a dental hygienist.
Sure.
This. How did
Right.
you guys? Because you have your own individual health problems, but
Yeah, but what you asked a good question. What is it within me and within Tammy that said, okay, there is a better way.
Yeah.
Let's go that way.
Yeah.
You know, and the reality is, who really knows what made me switch and believe this? I mean, for me, it was, I'm a very, show me a way. If it works, I'll follow it. I'll never question any patient that comes in and says, I do this and it works for me. Because what do I know? How do I know it doesn't work for them?
Right.
And luckily, that's the same way I deal with myself. I said, well, listen, who can argue with being sick for 15 years or whatever it was and having so many surgeries, and in 5 days all my problems go away, and the only solution I got from my doctor was to change my deodorant because I'm sweating too much.
That was the solution.
But that's insanity. I mean, that's actually like total denial and insanity, what your doctor did. And there's no way to get rid of him because he is so entrenched in the system that that's normal.
Right.
But I also think that they really don't know. They don't get any good nutrition courses. They don't get to learn about the body in a different light.
But they don't want to know because of what you just said. Their diagnosis and they treat
And
them.
they prescribe.
But it also comes
Yeah.
down to who's funding the hospitals and the schools.
But isn't that something wrong with the system? I mean,
Well, that's why we have new realities.
it is why
Yeah.
we need new
Right.
realities.
So let's go
because-
back. Yeah, go on.
No, but I'm just shocked by what
I know,
you just said.
but I want to know.
What was? Yeah.
You made your show is called New Reality.
Yes.
So how did you come up with that name? And if you had to think of your global vision,
Because exactly by what you said about this doctor didn't have it in your doctor didn't have it in his framework that food could be connected to health.
Could be a poison.
But it wasn't in his reality. It wasn't in his way of thinking is what
Right.
I mean by
Yeah.
reality. So what would shift him out of that? I don't know, maybe his own personal thing. But so realities are the way we think about the world. This guy, your doctor, was locked into a vision like this, narrow-minded.
Right.
And so my idea is we need to change the way people think about the world if the world is going to change.
Okay.
So how do we get people to think new?
Well, okay,
Yes,
so
yeah.
this to me goes back to, you said it's mind, body, spirit.
Yes.
And you said there's a lesson to be learned. Well, we each learned a lesson through being sick.
Right, and then by changing our thinking, though, opened us up into a new paradigm. We
Right.
said there must be a better way.
Yes.
Right.
So maybe at what point will these people learn a lesson, or maybe they won't?
Why be not this lifetime?
Exactly.
Right.
It can get.
I don't think
Right,
people
well-
have to get sick, though.
But
No, I don't either.
They don't. But so you say, well, what are you doing with the information you learned? Are we keeping it a secret? No, we're doing shows like this,
Right.
and we're educating our patients when they come in to the office because they want to find they want to get a new reality for their teeth.
Right.
And see how it
Yeah.
applies to the new reality they're already conscious about and applying to their whole body.
Exactly. So the whole new reality thing is taken about the body, but it's also taken about the emotional body, how emotions then impact our physical health, and what are the lessons we're learning from different emotional situations, you know, and how does that evolve us along a spiritual path. And the spirituality part is being conscious, staying aware, looking at reality sort of not so personally, but like sort of like not objectively, but you know, a perspective where you can step back out of the drama and notice the drama, but not indulge in the
Right.
drama.
But I think it's also, you know, people can't come in expecting, oh, well, teach me the new reality. You know, you have to have an openness to saying there's a possibility for a new reality. And you know how we have that little gut feeling, or we have a little birdie that tells us a story? You have to listen to that. Because maybe that's part of the new reality that you're trying to be
But
taught.
we can only
Yeah.
plant a seed.
Well,
Right.
Okay,
Right.
plant a seed. But my feeling, and what I've noticed with thermography and working with women especially, is there's a lack of self-care, of love of self. And it's not that they mean to,
But they do,
neglect
they're always putting
themselves.
on makeup.
I know, but it's different. It's deeper.
Yeah.
Because, you know, we put on makeup because we have to face the world in a certain way. But it's deeper when it comes to doing simple things like dry brushing. You know, there's some people who are, oh, like, you mean I have to do another thing in my day? Instead of embracing the fact of
it's
how
not like they
something-
have to. Do you want to clean your lymphatic system by dry brushing?
and very easily.
Yeah.
But this is where I'm talking about the bottom line
But-
is self-love and self-care.
But that's also connected to a whole new reality. People separate from their bodies. People think their bodies are just to carry their head around. It's not an integrated system.
But they also want someone else to take care of
Right.
it and
that
do
has
it.
to be a new reality too.
That's what I mean.
You're right. You're right. We have to take responsibility for our health.
Yeah, for ourself.
Yeah, it's like, you know.
But that comes from love.
It also comes from changing the paradigm and saying that I'm not going to go to you and expect you to, if you're a doctor, to
Write me a
take care-
prescription
Yeah.
and it be over.
Well,
And fix me.
Right,
Yeah.
at your conventional doctors, that's what they're taught and that's what they're used to.
Yeah.
But in our
That's-
paradigm, it's like we will show you the way.
Yes.
And it's your choice. Do you want to dry brush? Well, it'll work. Well, should I do? That's your decision. And it even comes down to, you know, how to clean your mouth properly.
Right.
You know,
self-care.
It's. Do you want to do it? Do you have this? I don't know if it's the word of respect for yourself. You know, in today's society, though, everybody is so busy. You've got
Well, it's
husbands.
time. That's what
But they're
they
not
bring
that
about.
busy to take care of it
Exactly.
because either you do it now or you do it later, right? When
Yeah.
your body's falling
But
apart.
when you have no choice.
Yeah,
Yeah.
exactly. So you
Right.
do it now when you're healthy and vital,
Right.
or you do it when you don't have the energy to do
Right.
it.
Try to get prevention
Well,
involved.
but I think what you're saying is so key: self-care, self-love.
Yeah.
It's not that you have to do another thing. No, this is the vehicle that carries around your consciousness, that carries around the world we're in.
Right, but if that person's schedule is filled 100%, what they need to do is say, okay, well, I'm going to schedule some self-care time and
Exactly.
get rid of whatever else that was taking up that time, because we are busy. We do have a full schedule.
What's
but
more busy? What's more important than?
I agree, but that's why you need to schedule in your self-care and say, okay, I'm going to wake up let's say I'll wake up 10 minutes earlier, just so I have an extra 10 minutes to do some dry brushing or meditating or getting an extra glass of water.
The reality is if you don't schedule it, you'll be so busy, you'll burn out, and then it's done.
Right. Well, I say scheduling because, you know, everyone needs a crutch. If you hurt your leg,
Yeah.
you need crutches to get around. Mental crutches are just as effective.
What do you mean by mental crutches?
Well,
Like,
if you have a mental crutch, it's like you use something like a trick to get yourself to take care of yourself. Everyone lives on schedules, so you schedule it in, me time.
Yeah.
And, oh, I can do that because it's me time.
Let me schedule myself into my schedule.
Yeah.
Right, no, but
Well,
I think that's also a sort of a kind of a wrong thinking type of paradigm. The whole thing has to be thrown out and say we start from the inner, go outward. You know, we start with the self. How do we care for the self, the body, the mind? How do we cultivate awareness, mindfulness? I think meditation is part of what I would schedule in as a part of key to understanding this connection to the self.
For a type A personality, the whole scheduling thing would work.
But
to write it down and know that it's now part of my daily round.
But I think it's still, we need to re-educate children to look at themselves differently, to look at their bodies differently, to not look at their body as a machine.
Right.
That's the old paradigm, the mechanistic paradigm, but it's actually spirit in form.
Right.
Yes.
And it's...
But the best way to train a child is have the child watch the parent.
Well, yeah. So what would you suggest, doctor?
Get rid of the computers at home and watch less TV.
Well, you could start. I don't think that's going to happen. I think there's another way of integrating that, which is about just taking time for yourself in the beginning, teaching children to do that.
Right.
Start with the self and then
go to the computer.
Exactly, exactly. But what I love about your practice in this field of sustainable holistic medicine is you teach people the steps. Like when I went to see you, you know, I had pockets in my gums, and you said use this. What was this machine?
The hydrofloss or the water pick.
Hydrofloss and the and then, you know, it completely cleared up, right? You did a pocket check and
your gums are healthy.
Yeah, because I started to use these simple devices that most dentists wouldn't even suggest.
Right, but you're an easy patient because you already have the system set up. You're already doing all the other sustainable principles for wellness.
Right,
so
I'm trying to eat good food. And
so
you're a happy person.
Yes, I'm happy.
You're definitely happy.
Yeah.
I am happier probably than most people.
Right. So you respond quicker. You respond almost like a child would.
Right, exactly.
Well, if you're giving me something that's going to help me, why would I not respond to that?
Well, that's the point. You understand that.
Yeah, but I don't know why everyone doesn't understand
They're
that.
too busy.
It's like, if you say dry brushing cleans your lymphatic system when you have a dry brush and it's like, well, actually, that feels really good.
It does feel good.
Good.
Right. Well, maybe, you know, there are people who are too toxic.
Yeah.
They don't have the sense of their own body.
That's where we have to start. That's the new reality. How do we give people a sense of their own bodies?
Right.
And
Reconnect.
Reconnect. And I think meditation, yoga, Tai Chi, Qigong. Actually, I do Qigong when I kind of sitting Qigong.
Yeah.
And I think just sitting, laying in bed with not waking up to an alarm clock. You know, as soon as that alarm clock goes up, people jump out of bed and they're in their heads.
It switches on and they go in motion.
Right.
You know, I wake up every morning at 6:50 before my alarm clock does.
You do?
I do. And I get up, and I wake up at 6:50 instead of 7 o'clock. You know why?
Why?
So I can take a longer shower. Because when I'm in my shower, that's when I do all my thinking, all my quiet time.
Oh, nice.
And that's
cleansing.
my cleansing. And to me, I love taking my shower. And I schedule an extra 10 minutes.
For your
I'm going to shower for 20 minutes. That's a long time.
Okay.
But I just enjoy it. And many times I'm thinking of things or I'm relaxing, and that's my quiet time.
That's very nice. How do you spend your quiet time?
Oh, let me count the ways. I journal, I write.
Journaling, that's a really key
meditate,
thing.
Right.
do yoga. I could go on.
You know, but I think it's so important, and we'll discuss this on my show, that there's people like you in the healthcare business that have worked on themselves, you know.
Totally.
That's what makes it a new reality, is the fact that, you know, you're not just doing it because it's like the fad.
Right.
No.
But you know, part of that whole new reality
It's
is,
been our lifestyle.
you know, people say when I tell them my story, they say, "Oh, you must be so angry at your doctor." I'm not angry at him at all.
No.
I even actually saw his son a few weeks ago and asked to send my regards to your dad because, you know, sure, I was near death and I was really sick and I was on disability for a year and I didn't know what I was going to do with myself. But once I found a way to get well, you know, to me it was a gift. Because then I passed it on to my wife and my kids and then to my other friends who would listen and then patients. And we created this whole sustainable way of dentistry from that experience. And we bring so much to our patients. So I was given a gift.
You
know?
were.
And
Well,
if I wasn't sick, I'd be talking about laminates today on the show.
Cosmetics.
no, but that's what I'm saying. That's the spiritual aspect of this, is that you use the situation to evolve your own consciousness.
Right.
When you could have been angry.
Right.
And that's what I say, body, mind, spirit, because you change your perspective and then change your life because of that. And we can do that in all the situations that
Right.
we
Yeah.
are confronted with. How do we
Right.
change our perspective?
Right.
then?
And I can tell you, many people say, you have a lot to be angry about. And I'm like, I don't have time to be angry.
Right.
There's
You know-
so much exciting new things to discover.
Right. And being angry
endless.
doesn't serve me, even on a daily aspect, it doesn't serve me at all to be angry.
And the other thing is what you've brought into your office, I think, is really important. The other alternative possibilities, the body work that you do, the thermography,
Yeah.
that also helps people in countless ways. I mean, people don't even know that they can use thermography, women, instead of a...
It's a great health tool.
And what do they use it for?
Well, they do
breast
it
exam
in
instead?
place of mammograms.
And what's a mammogram? What is what do they use?
for breast cancer.
No, but what kind of machine do they
it
use
gives
for
off
that?
radiation.
Radiation.
Oh, so they send radiation.
To,
A huge amount of radiation.
Right.
They do?
And they squish the breast tissue. So,
They're radiating and squishing it.
oh yeah, it's wonderful.
so they're using radiation to find something that is caused by radiation.
yeah.
Wow.
It's kind of silly.
Well, radiation feeds cancer. So if you're getting your mammogram every year, and if you have a tumor, you continue to feed it.
And thermography only uses
It's no radiation.
It's heat. You're checking.
It's your body's core temperature.
You're measuring the heat of the body.
Yeah.
So why isn't this in hospitals? Why are they still using mammograms?
Because it's a $1 billion business.
What is?
Mammograms.
And breast
cancer.
is a $1 billion
It
business.
is, sadly.
Isn't that awful? That
But again,
that
it's
people
the
are-
paradigm and standard of care. It's diagnose and prescribe and surgery and
But
chemo.
it's shocking, isn't it?
Yeah, but this is what they're taught.
Yeah, but we have to. This is why I do the show, because we have to change the way people are thinking.
We do.
Like, why can't every hospital have a thermogram?
I'll tell you. Here's one of the things.
Yeah.
Thermography will pick up a tumor at 2 years. It takes a mammogram 8 years to pick up a tumor.
Really?
So at 2 years, you look and you can definitely see something going on in the breast or the body part. So now the question is, well, what do? We can't cut it off. We can't do surgery. Chemo is too drastic. You can't do radiation.
So what do you do to you?
An alternative doctor would come in and go diet, water, exercise, sleep, yoga, lifestyle. Because your lifestyle will kill those cancer cells.
Right. Also, don't remember EMFs, the
Electromagnetic field.
So everything you can do in your lifestyle, and then you go back. But this is insane that the mainstream doesn't know this and can't. They're there to help people's lives. I know I sound
but they're taught, diagnose, prescribe surgery. They're taught a standard of care, and that's what
right. But it's the same thing that traditional dentists are taught about the mouth.
Yeah.
They're taught wait for a cavity to form, wait for gum disease to happen, like your pocketing did. Then when it gets really big, we'll cut your gums away.
Yeah, then you deal with it.
So what do you do for if instead of waiting for a cavity to form? How do you prevent cavities?
Well, the first thing we do is we look at the patient's nutrition. We look at their digestive gut, make sure they're eliminating on at least a daily basis.
Everything starts with digestion.
Then we talk about their pH. If you follow a sustainable principle,
Which means what?
Well, look at the earth. What's sustainability for the earth? Preserving the earth, planting a flower and not destroying the ground, and keep planting with the same crops, rotating so that you're not ruining what you start with. Right. Well, if you think about it, we all come from this earth, us humans.
Our bodies are earth bodies.
Right. Yeah. And when we die and go into a box, what happens? We decay away. We go back into the earth. Right. So if you compare us, let's say now, a tree has its own ecosystem within the earth. Well, our own body has also an ecosystem. Our mouth is an ecosystem in our body. Okay? So if you have a tree and it's not given the proper water, for example, what happens? It doesn't have the right amount of minerals.
Right.
So if you look up at the top of the tree, the leaves start to brown, they start to wither.
Right.
Well, if you don't give the body the proper nutrition in the stomach, right, what happens? The teeth, go look at the top, start to decay away, the gums start to decay away. So the mouth is like a barometer.
So instead of cutting the leaves that are dead and saying, oh, let's get rid of the leaves.
Yeah.
Right.
It's
Well,
like
here's
pulling
the deal.
teeth.
Well, see, your leaves aren't the life force. Right. Your leaves.
It's like pulling teeth.
It is. Well, the leaves aren't the life force of the tree. The life force of the tree comes from the root system.
Right.
The life force from us comes from our intestines.
The life force of our teeth, our mouth, our
Of
whole
our
Comes
whole
from our
body.
intestines.
That's where our immune system starts. It starts in our intestines.
Those are our roots.
Okay, so you said it earlier. So the way if you pluck the dead leaves off a tree,
Yes.
are you fixing the tree?
Yes.
No.
Oh, I mean, no. I mean, no. No, I was just saying, no, I meant, I know. You're not fixing the tree. It's like in Chinese medicine, if you have a headache, you treat the head. That was a
Yeah.
big joke
Right.
in Chinese medicine.
That was very
Yeah.
funny.
Yes. No, but,
Okay.
no, but yes, you don't cut the leaves at you look at the whole system. But this is
Right.
so logical. Why
It
can't
is.
this simple paradigm be presented at dental school or at medical schools?
One day it will be. That's what we want to do.
That's
Yeah.
what my show is doing on all
levels.
Yeah,
Yeah.
including education,
Yeah.
including science. Science is stuck in a little box of like
Yeah.
the atoms are this and go around this. Well, they've proven that the solar system model of the atom doesn't really work. It's more of a cloud formation, but some people are still stuck.
Still stuck in that paradigm.
Right. So everything across the board, our economic system has to change.
Everything.
But it starts, I think, with the body. What you're saying is really key into creating new realities.
Well, also, when you clean up your gut, when you really clean up your diet and your
Yeah.
food, not only does your body become healthier, but your thinking becomes clearer.
Yes.
Your spirit starts to engage in your life. Your moods change.
Well,
it's a pleasure having you.
Thank you, Alan,
Oh.
for joining us tonight.
Thank you.
And we're going to be
Stay tuned.
continuing on Alan's show
Yes,
right
they're gonna
after
be
this
on
show.
my show.
And he'll be interviewing us.
Yeah,
Isn't that what happened now?
kinda.
Kind of. You're very
You're
good
so
at this.
talented.
Alan.
I can't. It's a natural thing. But give them your information.
So if you would like to contact us, you can reach us at 212-973-9425. And if you want, you can give them our website.
www.dentistryforhealthnewyork.com.
And my website, newrealities.com.
Check it out.
Great. Well, thank you. See you next week. Good night.
Good night.